Welcome, everyone, to the lesbian, gay, bisexual, transgender, questioning, intersex, and two-spirit learning community. The LGBTQI2-S Learning Community is sponsored by the Technical Assistance Network for Children's Behavioral Health. The TA Network is the National Training and Technical Assistance Center for Child, Youth, and Family Mental Health and provides training and technical assistance to states, tribes, territories, and communities with grants from the Comprehensive Community Mental Health Services for Children and Their Families program, or the Children's Mental Health Initiative, or you may know it as SAMHSA's System of Care grantees. The TA Network also provides technical assistance and consultation to communities without System of Care grants and to the larger children's behavioral health field. I'm Kathy Lazier from the University of South Florida, a core partner of the TA Network. Whitney, if you could advance the slide for me. Welcome back to those of you that have joined us for the first LGBTQI2-S Learning Community on community resilience, trauma-informed care, and conflict resolution. And welcome to those of you who are new to the learning community. Topics are generated from individuals working in the field and the communities. Today's topic is on the LGBTQI2-S National Workgroup to address the needs of children, youth, and young adults who are LGBTQI2-S and their families. We will share how this workgroup can be a resource to you in your efforts to improve the lives and behavioral health care and support of youth who are sexual and gender diverse and their families. Next slide. I'm joined today by two members of the National LGBTQI2-S Workgroup, Dr. Peter Dimash from the Turnaround Achievement Network and the University of South Florida, and Whitney Burton from the Institute for Innovation and Implementation at the University of Maryland, the lead organization for the TA Network. Next slide. We don't have time in this hour to talk about all the work of the National Workgroup, but wanted to provide you with an overview, including examples of the LGBTQI2-S work in system of care and the family and youth partnership. Then we'll highlight two priority areas of the National Workgroup, data collection and utilization, and use of color. And we look forward to hearing from you with any questions and comments. Next slide. The LGBTQI2-S National Workgroup assists with guiding SAMHSA, the Center for Mental Health Services, and the Child and Adolescent and Family Branch in their efforts to develop resources, policies, and programs that will address the needs of children and youth who are sexual and gender diverse in their families. We are proud to say that with the support of the leadership at SAMHSA and the branch, the work has continued its efforts for almost 10 years. Next slide. The 45-member work group includes representatives from national and local advocacy organizations, national and federal government agencies, state and local systems of care communities, FREDLA, which is a national family organization, the National Youth Organization Youth Move, community representatives, university-based educators and researchers, foundations, technical assistance providers, and policymakers. Next slide. We have invited communities and programs to provide information, such as the New Mexico System of Care, Communities of Care, and the Ruth Ellis Center in Detroit, just to name a couple. I encourage you to visit their websites to see the amazing work that they are doing. Next slide. We are especially committed to partnering with families and youth in system of care through FEDLA, the family-run executive director leadership organization, and Youth Move National, and also the family work of Caitlin Ryan at the Family Acceptance Project. Next slide. At our most recent meeting, our 2016-2017 priority areas were identified and subcommittees formed. These include sexual orientation, gender identity, and expression, also called SOGI, data collection and utilization. Another subcommittee, the social marketing and education, which is currently working with SAMHSA Center for Mental Health Services, KSO-CTV, LGBT youth of color, clinical practice and community support, and strategies for leadership. As I said earlier, we don't have the time to talk about them all this hour, but we'll be sure to at another time. I now turn it over to Peter, who will talk about the SOGI-focused work, followed by Whitney to talk about work focused on LGBT youth of color, and then we will open up the phone lines for any questions. Now turning it over to Peter.
Great. Thank you, Kathy, and thank you, everyone, for joining today. It's just definitely many exciting initiatives that we have to advance knowledge and practice for diverse communities to address diverse needs of this population of focus. So it's definitely a lot of really great energy and work and collaborative partnerships that have been strengthened and are ongoing. We have two major deliverables that the data subcommittee agreed to develop within the next about 9 to 12 months. One of them is to compile national surveys to get a working set of criteria for how to ensure that the national surveys, these are surveys from the CDC, such as the Behavioral Risk Youth Surveillance Survey, the National Survey on Drug Use and Health, the many different government agency-sponsored surveys. When they go out and they collect data from thousands of people across the United States, they come up with very large reports where funding decisions are made based on the information that they provide. They eliminate needs, and current understanding within certain areas for health and human services in particular, and for SAMHSA, for substance abuse and mental health services specifically. We want to ensure that they're inclusive, right? That the demographic questions that are asked of people are in line with the current understanding of diverse communities. So when we talk about the LGBTQI2-S community, we need to ensure that they are certainly included and that there's a question structure that's in place to get accurate data, information, as well as comprehensive information to inform service needs and service provision. So that's the first task, because a lot of different surveys, they go through different approval processes, and government agencies have their own internal processes. So there's variation, or there's differences on how questions are asked around SOGI, the sexual orientation, gender identity questions, or they are not asked yet at all, right? So we're lining it up and looking across all of these surveys to say, well, are they inclusive as a whole, from a broad perspective? And then specifically, how are they asking those questions, right? And are they doing it sort of the best practice way to do that? So that's a major project that we've set as a major deliverable to produce. And so we have a working set of criteria for how to analyze those surveys and come together on providing recommendations and summarizing the findings for what that meta-analysis will look like. And then the second major deliverable is to analyze SAMHSA's national data sets. They have a national survey of system of care organizations, and they conducted many hundreds, thousands really of surveys and interviews. So they have a rich data source, and they did ask SOGI questions during that data collection. And so we are basically able to data mine or gather, among those sample of participants who identified as sexual orientation, gender identity population, we can then start to look at their responses, within that cluster, and run analyses and reports on things like needs and service provision. So that's another major project that we're developing. And so we have a data use agreement with SAMHSA. There are certain protocols to follow, of course, for confidentiality and protection of the data and things like that. So we're processing those internal requests and outlining our approach to what we'll be doing with that data for them, so that we know our direction and how we're going to go through the analysis phase of that rich data set. And then the next slide, I know we're talking about a national sort of picture of things, but we always consistently ask, and the national work groups consistently ask grantees and local service providers to please update their forms, right, to collect race, ethnicity, and LGBT-related data on their different types of surveys at the local level, at the program level, and where services are literally provided. Because many local agencies are not updated. They are using outdated terms, or maybe things that are not in line with the U.S. Census, the current versions of the U.S. Census, or the best practices around LGBTQI2-S population. So we're definitely always asking, at the local level, please ensure that, the approach here is that to add to the demographics, there usually is an intake process where age and, lots of different questions are asked around, the participant or client consumer profiles. That certainly SOGI questions need to be included within that mix. And the approach at the local level is that, why is it important to do that? Well, it's important to do that because that's what quality programs do. And the approach for explaining things to clients about, any data collection of any kind, really, for, when there's forms that are filled out or intake surveys or what have you, is to say, please help us to understand the diversity of the clients or the consumers that we serve. This is only to help us improve the quality of our services, to make sure that they're aligned with the needs of different populations. Right? And so that's the approach. It's a welcoming, inclusive assurance and statement that really, I think, should come up front, before the kind of rolling forward with the questions, as to introduce, well, why are we collecting this information? Well, because it's important to improve quality. So that's definitely a two-pronged approach at the national level, or consistently emphasizing that national surveys need to be inclusive, and then at the local level, certainly the local data collection also needs to be inclusive. And then the next slide, I know we were talking about aligning with behavioral health disparities impact statement requirements. So each grantee is required by SAMHSA to outline their populations of focus. Instead of a roll-up of a total number to be served, there's a need to outline the number to be served by gender, by race, ethnicity, and by LGBT, sexual orientation, gender identity. And so that's something that is part of the funding opportunity announcements, things that are required in terms of writing to that in the grant proposals that are submitted in for funding. And then in the notice of grant award, the congratulations, award letter, there's terms and conditions to remind, the grantees that there are certain, conditions or requirements, compliance-related things. And so one of these things is the Behavioral Health Disparities Impact Statement. Within 60 days of a program beginning that's funded by SAMHSA, grantees need to produce a Behavioral Health Disparities Impact Statement, which is basically to outline, how data collection will be inclusive, how policies and practices, policies and procedures will be lined up to address the disparities if they are found, among different populations, and that there's alignment with the class standards, the cultural linguistic competence, cultural linguistic appropriately standards in healthcare and healthcare provision. So the class standards is a set of guidelines for how to ensure that operations and policies and procedures are inclusive. So that's what a behavioral health disparities impact statement is looking for. And it's all about, services being inclusive. That's definitely the approach. And so a lot of times we find that there's a need for some examples for how do we ask these questions about sexual orientation and gender identity. And so that's a frequent topic of technical assistance requests and conversations, and where there's a discussion around, well, okay, we can put it on a form, but how do we ask this? Like, how do we implement this? Go about doing it? When do we ask it? Things like that. And so the TA network is definitely here for you to help you in direct ways for any questions you might have about, anything specifically about operational considerations, or the how and the when, or the why and the where. And so these are some data collection examples that we see in the field, where there may be a question, for example, that says, which of the following options best describes how you identify your gender? Someone might say male, female, transgender female. And another question that might be asked is, which of the following options best describes how you identify your sexual orientation? heterosexual or straight, gay or lesbian, bisexual, not sure, prefer not to say, or other. And then in some local areas, we have found that they might have the little, the check boxes where it's under gender, where there's an M or an F, like checkbox, and sometimes, at least a request would be that they would add, one more checkbox, right? And so there are stages of, things that can be developed to ensure that there's, inclusivity of how these questions are asked. But the next slide shows some best practice, right, types of questions that have been put forward. This one is the National Health Interview Survey, the NHIS measures for sexual orientation. And they ask questions a little bit differently. And they're considered a best practice or a really great way for you to align with the current understanding of what good questions look like around this area. And so this question is, which of the following best represents how you think of yourself? And so they have those item response options, gay or lesbian or gay or straight, that is not gay or lesbian or gay, bisexual or something else, or I don't know. Right? And so that's one major best practice question that's available to you. And then there's another best practice question for gender identity. And this is the Gender Identity and U.S. Surveillance Group's best practices for gender identity. This is what we call the two-part question. And this is definitely a gold standard. It's something that has a lot of accuracy and acceptance among diverse communities. And so this is the definite preferred way to ask about gender identity. And it says, what sex were you assigned at birth on your original birth certificate? So male or female would be there. And then there's a follow-up question that says, how do you describe your gender identity? Where someone can say male, female, male to female transgender, female to male transgender, or other. And then there's also a more in-depth report, around rationales and information and some wonderful data that report that they have produced, and that's available at the link, at the bottom of that slide. So that's the approach, and we definitely want data to be inclusive and to have a much more in-depth understanding around diverse population needs and how those different populations have needs that compare with other groups, and as well as ways that service quality can be improved. And we really want to move toward success stories, right, for how local communities have basically become more diverse focused and have been able to have welcoming services and quality improvements and wonderful success stories for clients and how the services made a difference in their lives. And that's where we really want to have those examples shine and show the positive aspects of why diverse data collection and diverse practices are beneficial not only to this population, the LGBTQI2-S population, but to all populations. So there are many, many different benefits there. So I will go ahead and hand it back to Kathy to connect on the next steps, and that is the component about how the data subgroup of the national work group is pursuing this and trying to provide as much assistance as possible at a national level and a local level. Thank you.
Great, thank you, Peter. And we'll be able to take any questions after the presentation. So I'm going to go ahead and turn it over to Whitney, who is going to talk about another one of the subcommittees and priority areas for the work group on youth of color. Whitney?
Hi, everybody. So I'm going to talk about youth of color and some of the priority areas. So basically, when we talk about youth of color who also identify as LGBTQ, what we hear them say is, I'm often siloed into one of my identities, but I am more than that. I am a whole person. So when I receive services, I want my age, my gender, my race, sexual orientation, health status, education, all of those I want accepted and served at the organization to the best of their ability, which is why you see I'm not just Black, I'm not just Hispanic, I am First Nation and I'm two-spirited, or I'm First Nation and gender nonconforming. We want to make sure that we do this with youth of color that are LGBT to ensure that we encourage, one, their development based on gender and sexual identity, but also that we are affirming their ethnic and racial identity at the same time. Those two things don't develop in a silo. Most of the time they are intertwined. What we find out when we do make youth choose which identity that we're serving by not asking those questions about how can we best serve you, how do you identify yourself, is we're actually putting on them microaggressions. So we're increasing their internalized but also externalized feelings of prejudice for for homophobia and for racism. And we know that basically this decreases their self-worth. With microaggressions, particularly with youth, there is this idea that some of them are real. So the woman that clutches her purse as you walk by because she thinks you're going to run off with it, and then some of them are perceived. Maybe the receptionist is just having a really bad day, and she doesn't acknowledge you when you first walk up to the desk. However, what we do know is that these microaggressions increase hypervigilance because they have an expectation that they're going to reject it either for their racial or ethnic status or for their sexuality or gender. However, what we are finding out is that youth always have strategies to build their own resilience. So with this, it's the idea that they will build their own social networks and resources, and that resources can be perceived. So what resources can I anticipate, whether they're emotional, whether it's knowledge to actually access physical resources like housing, food, or shelter? How do I fall into the hierarchy of these resources? So am I supposed to offer resources to someone else, or can I receive them without bartering something? We also see that youth are creating families, so not just communities, but actual family structures. We see this in a lot of East Coast African American and Latino communities with the house ball structure. Now, house ball are typically associated, or house ball communities are typically associated with negative health outcomes. However, what it does do that's positive is it reinforces the fact that you can be LGBT, Black, Hispanic, that you have a community that actually reflects your identity, and that the community most of the time will help you access resources, particularly if you're new to a city like New York and don't know where to receive things. We see that these youth are adaptive socializers so that they can move through different fields and geographical areas by code switching. So talking in one colloquialism and then moving to another one. And the whole point of this is to build up connectivity, because we know that people who have social supports of some type are more likely to have better health outcomes, but also do better in treatment of any kind. We also know that their self-advocacy is linked to their self-identity. So when youth are misgendered or when their ethnicity is marked as wrong, they're very quick, if they have the ability, to step up and say, no, that's wrong. And it's not being disrespectful. It's because they want to ensure that you know who they are coming in the room at that moment. Now, on a national level, I need to say that these resources that you can see are not an exclusive list. These are just some that were pulled from across the country. Black Girl Dangerous, Native Out, and Youth Radio are all platforms that are internet-based. However, the other organizations are brick and mortar, and they range. So Colors in California offers mental health services. Casa Ruby, which is located in D.C., offers shelter and case management. Audre Lorde is social justice-based. Star Trek in Baltimore focuses on HIV and STIs. However, they also offer case management. The Brown Boy Project out of California offers services for masculine-centered women, gender nonconforming, and they have a whole leadership program. So they're also social justice-based, but understanding that the next generation will take on the movement. And I'm going to turn this over to Kathy. I've switched the slide.
Okay, thank you, Whitney. So that is just an example. Really, we wanted to give you an example of a couple of the different work groups and the priority areas that the National Work Group has. And some of the additional support, includes, as we said, a leadership brief that's in draft form now. For those of you that are working on, efforts around addressing the needs of your LGBTQI2-S community, the youth, and their families, including caregivers who are also LGBTQ. So what we'd like to do is also let you know, and we'll be letting you know as it goes on, that, as I said earlier, that the KSOC TV, which you'll be hearing about in the TIA Telegram and various other ways to get you the information, will have an episode. I believe it's going to be either January or February. We're working on things like monthly minutes, the clinical best practices in terms of tip sheets, and also these bi-monthly learning communities. Another area that, in terms of the use of color that we're working on is a tip sheet, and also resources looking into affirming faith-based organizations. So we are trying to put together a host of resources that are easily accessed. But as I said, we're focusing on the use of color in data collection and utilization on today's call. So we wanted to make sure, because these calls really are learning communities and open for discussion, so we try to leave a lot of time for discussion and for questions and comments. So I'm going to go ahead and ask Colin and Whitney to go ahead and open up the line and see if we have any questions or comments, or people having experiences right now, or that they'd like to share, or any questions in terms of data collection or addressing use of color. No, I know that another area that, and it's a question in terms of tip sheets that we're going to be doing, is we recognize that a lot of the resources that people want are care coordinators, case managers, the workers that are working directly with youth families. And so one of the things that we're really trying to work on with this particular work group is having those kinds of resources available. And another piece, and Peter is available to help with anything in terms of, looking at your forms, updating forms to collect race, ethnicity, LGBT data. And part of that is about the process. And I don't know if, Peter, you want to talk a little bit about some of the experiences, or an experience that, for example, you did a lot of work in Mississippi around just getting the community, getting their heads around the idea of asking these kinds of questions.
Yeah, and there's many different types of supports, right? So it's not just kind of dropping a survey out and saying, well, this is a compliance issue, or something that we're just going to have your frontline service providers to provide, and just get us the data, right? So there's definitely a process for ensuring that there's feedback and how the process works best, when to do it, and things like that. One of the first things that is supportive of the data collection is that individual staff need to feel supported, right? So if they're looking at things like disparities among racial, ethnic, gender, and LGBTQI2-S groups, that can be semi-controversial, right, in terms of looking at inequities among different groups of people in particular regions where there's, a lot of just social issues, we shall say, in certain regions. And one of the things is that I always say, if a staff member doesn't feel like, if they feel like they're sticking their neck out and taking a risk, right, by addressing disparities or highlighting needs of certain communities, then there's a silencing effect, right? So they need to feel empowered and supported by the administration of an organization, and have that reinforced. And one of the first things to do is to have an inclusive and non-discrimination policy for employment. So because that's the local reference for, the employment. You cannot be fired for, either being part of a certain group by race, ethnicity, gender, sexual orientation, gender expression. But also this is for allies, right? So these are people who are advocates or allies for the needs of other people. They might not be themselves, part of a specific group, but they want to have good quality care and, attention paid to disparities in those needs. So that's a supportive thing at the local level to ensure that helps, to ensure that the data collection will be supported and, and utilized. And then another aspect of this is to have welcoming environments that are signified. So, for example, in many communities that I've worked with and currently work with, we have a safe zone signs, right at the front door when you walk in, on the inside wall, at the waiting room desk or in the waiting room itself, or just the common area, the youth drop-in center area or a conference room area, right? Some kind of place where people gather, if you will. And they have a sign that says, this space respects all people, right? And then it lists out the different aspects of, of everyone, by race, by ethnicity, by gender, sexual orientation, gender expression, et cetera. And it's a strong statement, that's put up. And it's not just kind of something you plop on the wall, right? It's something to emphasize and, be incorporated into staff trainings and orientation, sessions and, ongoing staff meetings and things like that, so that staff know that they're supported in that way, and that consumers will come in and see, wow, this is a place that is really a place you want to be, a welcoming place that's inclusive of everyone. So that definitely helps at a local level in terms of implementation. And then it becomes, you get into operational types of things. How long does it take, and when do you ask these questions, and things like that, and other dynamics. So the nitty-gritty, sort of specific day-to-day type things. And so we're here to help with, any type of, well, what do we do, first, or what do we do next, or any kind of ways of thinking about it, but that you may have questions about. But definitely, I would encourage definitely utilizing the expertise of certainly the youth and the families that are within your service area, and then your permanent consumers that are enrolled in services. They are certainly the experts on their own, how they want to be treated, how they want to be regarded, and engaged with. And so they can inform that process on how to, what the best thing would be for, from what they would see for them and for people like them. So that's definitely been a successful thing, and we see models of success and wonderful things. I just was taking pictures this week, actually. I was crisscrossing Mississippi. There are 5 systems of care here, and taking pictures of, different things on the walls and talking with youth and families and service providers, and they've got their safe zone signs up, and everything's going great, and stuff like that. So it's nice to see success stories where they weren't doing something previously, or didn't think to have those certain questions on the demographics section, or just didn't have things in place, and then implemented them, and then had success with them, and now they've got wonderful data reports and other things to be able to zoom into aspects of different disparities and disproportionalities of challenges that people are having. And it's different for every area you go to. It may be, a housing-related disparity among racial and ethnic groups, or it may be, juvenile justice-related disparity that you will find. It's how the data can show and lead to or it might be vocational supports, for example, like discrimination and employment for people who are transgender, right, or service providers that they have sought to, to receive medical services or hormone, treatment services or things in the local community, and they've, had people being rude to them, or whatever the issues are, that you'll definitely find, some areas for opportunities for improvement and inclusive approaches and ways to help the systems of care. And that's definitely a major advantage of systems of care is that it's not just one siloed area. There's definitely all the full spectrum continuum of care for people's needs: housing, employment, supports, medical related linkages, behavioral health, certainly, mental health, et cetera. So there's lots of different ways to engage with partners in their communities to ensure that people who are in need of services, maybe they need a referral to another agency to help them with a certain need. And so the approach is to make those interconnections with the systems of care, and then to also see how inclusive they are, in terms of their policies and procedures, or whether or not they're even addressing LGBTQI2-S related needs. So this is definitely an opportunity and great things that we see in different areas to expand this service continuum for people.
So, hi, this is Whitney. I just want to add on to what Peter said about the data and how that is going to drive your practices to be client-centered. An organization in Maryland had data where they were asking who's more important and more effective in your life in keeping you engaged in care and your treatment status, who do you go to in times of need. And what they found out was a lot of the young adults and youth, even that were minors, engaged in their services. It wasn't their biological parents or even family, that it was youth their same age that they had created families with, who were more likely to drive if they stayed in service, who were more likely to offer them various supports. And from that, they did a pilot, and then they implemented for psychosocials. Yes, you can have a biological family psychosocial, but they also needed to create a created family psychosocial, and then looking at their policies around confidentiality, things like that, and how does that look different, and what are the state laws of Maryland, and what can you or can you not discuss, depending on, one, the age of your actual consumer, but then also the age of the family, because a created family isn't linear. It's not that the parents are older and that the child or grandchild, quote, quote, are younger. They could all be within a 3-year span, or maybe a grandparent is actually younger than a grandchild, as these families are created and people create these support and resiliency systems. But they found out once you engaged this whole created family structure, it led to one, addressed stigma of mental health and health services within the pocket community around the center, but it also helped people stay more engaged in care, and they felt more trust in the agency. And that was all based upon just a simple question of, who's important in your life, who's going to encourage you to do what you need to do, and how do we support your focus.
Yeah, thank you.
Yeah, and there are inclusive data are very powerful in terms of improving quality of services, as well as their organizational advantages as well. Recently, for example, there was an organization I was working with that they saw that there was a CDC grant, for example, that was available, and there was a focal area, opportunity area to focus on prevention, services for the transgender population. And they were very much interested in, expanding services and moving to provide those. And one of the first questions, certainly the first question that I asked was, "Oh, that's great. That's wonderful. What data do you have on this population?" I said, "Oh, we don't have that data." And I said, "Okay, to apply for a federal program, you in many instances, certainly you want to have a local data set that shows that you're sort of on top of knowing what the needs are among a certain population within the first section of a grant application. Like Section A is the needs assessment, or the statement of the problem, or statement of the need of what's going on in this local geographic area, what's your population of focus, what data do you know about what's going on with them in terms of their needs, their social service related needs." And if that story, if that data are not available at a local level, it would put a local grantee at a disadvantage in comparison to other regions of the United States where there are other grantees that they have that data And so, from a funding perspective, and a organizational development perspective, inclusive data are wonderful because it helps to expand services, expand grant opportunities, and lots of different organizational components for funding sustainability and other things. So not only on the, there's a multi-level wins, if you will, frontline practices and services and engagement with clients. There's organizational, structural, advantages in terms of policies and procedures. And then at the administrative level, certainly the expansion of funding and, the expansion of services, the infrastructure of providing quality care services for people. It's definitely win-win. And, in terms of any disadvantages, there really aren't any. I mean, there are things that are needed in terms of some time, to put things in place. There's an update of some forms. It's really, in terms of any administrative burdens or challenges, they're minimal. I mean, that's what we've seen is that there may be some questions or hesitancy or sort of, areas of we're not sure about, how to do something up front, but and that's why we're here to provide technical assistance, to help with that process and make it as smooth as possible.
Yeah, an example, Peter, I was going to say, an example of that, too, is a community that we had done some work in, I had done some work in, where they had wanted to add some SOGI data collection, and it was not just data collection, but it was about, how to develop good treatment plans and servicing coordination plans, and they were changing some of the CAN questions, the Child Adolescent Needs and Strengths Assessment Instrument, and wanted to include questions about sexual identity, gender identity, sexual orientation. And so they had a training for the Juvenile Assessment Center officers that were going to be the ones who were going to be doing the interviewing of the youth and asking that question, but they really felt like what they needed was some training about how to ask those questions, about the terminology, about the possible responses that they might get. So I think, as Peter and Whitney have both said, that it's so important to collect this information, but it's important to be comfortable to collect this information, and it's important to make sure that the youth and the families that you're collecting the information from trust you and are comfortable in giving you that information as well and feel safe doing that. So are there any other comments or questions? Anything else, Peter or Whitney, that you'd like to add? Or
just in terms of for larger organizations in particular, where there are many different programs and services and, lots of different departments and, I'm saying, multi-million-dollar on up, types of human services organizations that provide a lot of different, things to people. They, in terms of implementing something system-wide, maybe there is a step that might be appropriate in terms of administering a climate survey or something that is a self-assessment tool for use with, for staff and contractors to, that ask questions about their levels of comfort, right, for working with diverse types of populations, some attitudinal types of things to, just to kind of take the temperature of where things are in the organization, that there may be a need for cultural linguistic competence, an on-site training session or something to address some concerns or things that are going on with any especially if there's ever been a sort of grievance event that's happened, and there's something cultural where there's been known to have been some type of bias related thing that happened that was negative in an organization, and so where staff may be sort of careful about things and remember when something happened. Organizational culture is a very dynamic thing, and so, in terms of administrators, if they are wondering whether their staff are ready, right, to just to full-on implement, inclusive and data collection. That's an interim step, particularly for large organizations, as I mentioned, that they may want to pursue, to have in place. Lots of times, organization leaders will say, I think we really need a training, like a webinar or an on-site training to get people kind of oriented to this, first. And that's totally, valid and reflective of them kind of knowing the pulse of their local, organization and those needs. So that might be something that's appropriate, and that we have resources to provide things in that direction as well.
I think with that assessment, you also want to just check a pulse, particularly with direct service employees, of how well do they understand colloquialisms or different cultural linguistic things for the geographical area you're working in. So for youth of color, there are sometimes different terminologies. So instead of using the word gay, it could be same gender loving, understanding that there is some oppression linked to and within the gay community that youth of color don't feel as comfortable using that label. So two sides: one, having staff and understanding what their level of understanding and knowledge are of terms, but then also touching base with the clients you serve and say, what are some terminologies? What's going on? How do you do this or that? And that is going to be ongoing, because we know that language, particularly with the internet, is constantly changing. But if you don't understand what your client is communicating to you, then you're going to be ineffective.
Very good point. Thank you. Okay, so if we did include some additional resources in the PowerPoint slides, a few of them that are listed here, and also just to let you know that there are additional resources in the CLC Resource Library that's housed at the University of South Florida for eliminating behavioral health disparities. And also, just if you have any questions at all about the National Workgroup, or if you have any technical assistance needs for your community around the LGBT population, please don't hesitate to contact either Peter, Whitney, or myself, and our contact information is there. We have these bi-monthly calls. Really, as I said, it's generated from the field, people wanting to know, resources that are out there, activities that are going on, or incidences that have happened. So we really appreciate you all being here. And again, if there are no other questions, I'll wait another minute or two. Okay, well, we'll go ahead and close the call, and just appreciate you all being here. And Whitney and Peter, thank you very much for joining us on this call and talking a little bit about the subcommittees that you're working on, the National Work Group. So thank you all very much.
Thank you. Take care.
Bye-bye. Thank you, Whitney.
Bye.
Bye-bye.